Okay, hi again, everyone. Nice to see you. Gonna get started because we're running a little bit late here.
Oh, don't rush.
Okay.
You're rushing on our part.
All right. I'm gonna take about 5 minutes just to give a few highlights of how I've implemented CABs and thought about community engagement in the context of my MRP and some of the other research that I've been doing since. So just a few highlights about my MRP. This was a project focused on the barriers and facilitators experienced by sex workers at the Mexico-Guatemala border around ethical engagement in HIV and substance use research. And this is a context in which I was developing my program of research at the time, and it was really helpful timing in terms of just starting out some new qualitative and survey research we were doing and being able to work in a new community for the first time. So the CAB was an opportunity to get together with different organizations locally, including women's organizations, the Guatemalan National Sex Worker Rights Organization, local public health and HIV organizations that were working in this space, as well as to get feedback from sex workers around the approaches that we're using in the project and the overall concept. The CAB met twice, once at the beginning of the study and once, I think, about halfway through, once we had some preliminary findings to get feedback on the approaches we were using, the data collection instruments, the language we were using, and also to talk about how the findings would be used. And a lot of these connections ended up being really helpful through subsequent stages of the research, even though I didn't continue a particular line of research in kind of the ethics side of this. It was definitely important formative work that helped in terms of establishing just the regular program of public health research that we were doing in this community. And this is just a poster of some of the sort of community workshops that we did near the end of the project. We came back, had some workshops with the women, talking about what we learned, talking about some of their rights as migrants, in these communities, as sex workers in these communities, and they really appreciated just kind of being engaged in that way. So I'm happy to talk about some of the lessons learned. As you all know, this was a requirement of the MRP. I had been involved with CABs previously, through my mentors, and had sort of heard of them and seen them, but it was my first time really developing my own right from the beginning, so it was a really helpful initial experience for me. Since then, I've been PI of a large NIH-funded, NIDA-funded cohort of sex workers in Vancouver called an Evaluation of Sex Workers' Health Access, which is a complex and sensitive study, as you can imagine, and it really requires careful community engagement. And so what I'll say about the CAB for this study is that it's kind of only the starting point of how we engage with the community, and it's one of many mechanisms, and that's the main message that I wanted to share, and I'd be curious maybe to have some discussion in here from my colleagues as well, how they think about this. The Aisha CAB, Aisha started as a very community-based project long before I came onto the scene when I moved to Vancouver in 2013. The study started with community-based grants through the Canadian government in 2005, where they did community mapping, community priority setting for the project, and so its inception really started there. So I was really fortunate to come in to a project where there are already a lot of community relationships and infrastructure in place. And so we've maintained the CAB, meeting at least annually, sometimes more often. And to be honest, because this is a well-established study, a lot of what we do in those CABs is really vetting new ideas about how the project is evolving, and most importantly, talking about what we're learning in terms of sharing findings that are coming out every year, getting feedback on what the priorities should be for the coming year, and how we can use the findings together to translate them into policy and community action, and how the findings can be useful to our community partners who are really active in this space. And Vancouver has a long history of community activism around HIV and substance use and sex work. And so especially the sex work organizations we work with, which are really our primary community partners, are all staffed by or for sex workers and have really strong views on what the policy directions are that are needed, what are the programs that are needed, and so they have amazing feedback on the work. But we really have to be careful too in how it's presented and how we're thinking through things in a way that's really serving the community. In addition to the CAB, we have a multilingual and multicultural team that does weekly outreach. It's important for retention in the cohort, as well as one of the ways that we also give back to the community. And so similar to what I talked about yesterday, we have a separate grant just for our outreach services through the Public Health Agency of Canada. It's an alliance with 2 other sex worker serving and led organizations in Vancouver, where we do weekly outreach. We're distributing harm reduction supplies, condoms, providing information, helping women fill out bad date reports, connect with any kind of resources or referrals that they need. And this is honestly one of the most rewarding parts of the work that we do. And then lastly, I'll just mention that policy engagement has been a huge part of the community engagement. I talked already a little bit about the CAB. These are just examples of some of the outputs that we've developed with our community partners. So our NIH cohort renewal from 2015 to 2020 focused on the evaluation of a change in the sex work laws in Canada, which was called the Protection of Communities and Exploited Persons Act. And this was a law that really conflated sex work with trafficking, and we documented significant harms of this law over that 5-year grant period. And so near the end of the grant period, we collaborated, we met with the CAB. We also had a working group of sex workers who were really interested in this topic who met after the CAB to help contribute to the report and give us feedback on the findings. And so this was a community-partnered report that was submitted to the government as they were deliberating some policy revisions. We're really active on social media with this stuff. Most recently, the government is actually reviewing the laws now, and so myself and the qualitative PI, there's a qualitative arm of the study as well, Dr. Andrea Cruci, she and I had the opportunity to participate in the House of Commons Standing Committee on Justice and Human Rights a few months ago, where we presented some of our work and showed really the scientific evidence for the harms of these laws. So that was a good experience. And there is a federal sort of charter challenge happening as well, where Dr. Cruci is an expert witness, and we don't know what the outcome of that will be. It's still underway. Another piece I'll just mention is that some of this work led me into a really exciting opportunity to partner with sex work community organizations, specifically the Global Network of Sex Work Projects, which is the sort of global consortium of a lot of the rights organizations around the world. And I was able to be lead editor on a book with them and some partners from Johns Hopkins universities as well on this book. Each chapter is a collaboration between either a sex worker or a sex worker organization and an academic. And so it was a really unique product in that way, and I feel like all of these experiences I had leading up to this prepared me to know how to do that and how to do that respectfully, and I think there's lots of new ways of doing academic work like this that really excite me that I hope maybe some of your work will lead to as well. So I think that's all I'm going to say for now. I talked about IRIS yesterday and I want to make sure my colleagues have enough time, but I'm looking forward to the discussion.